Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to our fourth edition of Not Just a Dog, Honoring Hope in Healing, recognizing the caregivers to celebrate National Doctors' Day. And to celebrate this day, today we have with us Dr. Sreekala S, Senior Consultant, OPG, SUT Pattom Hospital. Welcome to our show, ma'am. Ma'am, congratulations on National Doctors' Day to you.
Thank you.
Ma'am, this year we are celebrating the fourth edition of Not Just a Dog, which is an extraordinary celebration dedicated to showcasing the remarkable efforts of our doctors and expressing our heartfelt appreciation for their selfless service. So, the campaign Not Just a Dog aims to celebrate and highlight the person beyond their profession. We know how much of hard work does a doctor put in to treat their patients, but now on this occasion, this day, we want to celebrate the doctor who is the person who is beyond this profession. Ma'am, I would like to start with what inspired you to pursue a career in medicine, and how do you balance your personal and professional life? Although it is very difficult, but I still want to know how do you do that?
When I took the medical entrance, that time I was not aware of what it meant to be a doctor and what all trials and tribulations are awaiting me. So at that point, I just wanted to prove to myself because it's a tough entrance, and I wanted to clear the entrance and get admission. That was more important at that time. And once I joined medical college, then as I started seeing things and understanding things better, it became more and more clear to me that this is one place where there is no half measures. You have to dedicate all your time and energy and resources into it. Only then you can become a good doctor. And then there have been times when I considered whether it was a good thing to select medicine as a profession, whether it is worth all the trouble and all the effort that you put in. But later on, as time flew by, now I've come to the realization that this is a profession where you're constantly doing good to others, constantly sacrificing your time and pleasures, constantly putting in all your efforts for the sake of others. This is one place where your work itself is service. You don't have to take time off from work to do some service. Whatever you are doing is service. And so it is fulfilling in that way. And when it comes to work life balance, it's a very tough thing. Uh, you cannot give 100% in profession if you want to give 100% to your personal life. So there have to be sacrifices, and generally what suffers is the family life, the personal life. And actually it takes a lot of effort from all those around you. You know, your family has to really support you. Only then you can do justice to the profession. And so it's a very it's like a tightrope walking, it's not very easy, and you always do not attain that balance. um, Generally you sacrifice a lot of time that you have to devote to your family, and they are the ones who have to be congratulated or say celebrated, actually. In the case of when you want to celebrate a doctor's life, a large part of it uh, goes to the family members, especially husband and children.
You said it right, ma'am. If we have a family which is very supportive and understanding, then I don't think there's need to balance it. They help us to balance, and they help in understanding their profession. So it becomes easier for doctor as well if the family is understanding and supportive.
Yeah, really. Actually, it also means that your spouse has to really respect your profession and respect you to make you to free you from all
Yes.
the other troubles at home, and set you free so that you can pursue and you can dedicate your time to your career.
You said it right, ma'am. Ma'am, like you just explained, it is very difficult to get out time from your profession. But still, if you have a little bit of time, so what hobby or interest that you're passionate about outside your medical practice, and you try to do that. So what exactly is that, ma'am?
Actually, I used to be a very avid reader when before joining medical school, and actually, the profession has taken a toll on my reading habit. But I have a very intense general interest in everything that is going around me. I follow books, sports, politics, music, everything. Even though I don't actively participate in any of these things, uh, I observe everything, and I that makes me feel part of the society. And whenever I get time, I try to look at what is happening around me, and that is what is integrating me with the society. Uh, what I do. For example, I try to read. I cannot read continuously like I used to do before, and sometimes I feel a little bit of guilty conscience when I read something other than what is related to the profession, because there is a truckload of material that is waiting to be read. Regarding the professional matters, new articles, new journals, things like that. And then to devote time to some reading for pleasure, sometimes you even feel guilty about that, which as a person it is a little sad, but uh, that has to be.
And I can understand, ma'am, if a person what he or she likes to do that, and because of work it is not able to do that, it feels little guilty. But then it's something like you have that kind of satisfaction. Okay, I'm doing my work honestly. I'm putting my efforts, full efforts to my work, to the service you're providing to the society. You're treating your patient. That is something I believe that covers that guilt. So
Yes,
that
yes, of
that's
course.
little
That is
helpful.
exactly what is compensating for sacrificing all the little pleasures of your life. That satisfaction that you get that by doing something very diligently and very sincerely, then that is helping some other person, it's helping a patient uh, in some way. That whatever you do to increase your knowledge is helping a patient. So that is what is compensating for the little guilt or the sadness that we feel by sacrificing all those things.
Understand, ma'am. And ma'am, any advice you would like to give to fellow doctors about pursuing their passion outside their profession so that they can unwind
Um,
themselves and de-stress after a long working day?
Yeah, I don't know whether it is proper for me to give advice to someone, because each and every person is different, and their needs and what their likes would be different. There are people I have met, people in the profession who don't look left and right. All their life is their profession only. They don't want to do anything else. There are people like that, and there are others who have time to pursue their passions, like some are into singing or dancing or whatever. There are people who do that also. For me, after a long day, probably I would uh, listen to music, or scroll through the news, because that is what I want to do. I want to be aware of things happening around me. Or sometimes I'll just sit quiet and have a conversation with myself, you know, about what happened during the day and what it means to me, or uh, things, whether I could have done things better, or you know. This conversation slowly takes me away from stressful things, and then you come to terms with what you have been doing, and then slowly uh, you recharge your batteries. I like to do it a lot. I like to sit alone and meditate, or muse. Another person
I
may
can
want to.
understand that feeling, ma'am, because yeah.
Yeah, for another person,
Yes, ma'am,
it
please
may be
continue.
like they want to go out and meet people, and that is their way of unwinding. For each person, it's different. So it's not a question of giving advice, but everybody has to do what helps them to unwind, and they have to recharge the batteries in
You said it
between,
right.
because you cannot take all the stress continuously without break. That will break you.
Exactly, ma'am. The time which we get by ourselves, that alone time, that because I believe I agree with that, irrespective of the profession. When you have a stressful day, a long day, when you sit with yourself and you analyze what happened in the whole day, what went wrong, what went right, everything that declutters your mind, and that helps you to
Yeah,
understand. Okay, whatever happened happened. Let's accept it and move on, and let's take the day forward. So that is
really.
one of a very relaxing time, whether it's 5 minutes, 15 minutes, half an hour, or any hour you get with yourself.
Yeah, true.
Ma'am, there's one more thing. You interact with your patient on daily basis, and doctors have to get into, indulge into a patient's life so that they can understand uh, the this thing disease, and can help that helps to diagnose it better when you indulge with your patients. So what do you enjoy most about interacting with your patients on a personal level, and how does this enhance your medical practice?
Actually, human interaction is at the core of my profession. You have to get the patient to tell you their trouble, and then you have to be empathetic to them and listen to them, and build a rapport with them, and only then from there you can move forwards to solving the problem. So as a doctor, I don't feel like I believe I don't believe in standing on a pedestal and talking down to a patient. I believe my interactions should be on equal footing. I interact like a friend, or an equal person, so that they will come out with their problems in front of me, and the more little more you can delve into it personally, uh, it's better. It will better enable us to make the correct diagnosis and solve their problem. Actually, after all, it's we are both, the patient and the doctor are into it for solving a problem, and what I need is trust and
Yeah.
compliance, and for them I have to give empathy and understanding. So it's a mutual thing, so the more you interact on equal terms, the better it gets, the better your interaction with the patient gets, and the better the rapport is, and that helps in solving problems better.
You said it right, ma'am. Both patient and doctor are involved in a process to sort out the treatment, to solve the problem, and that relationship, that trust helps us to do that. So the way I believe doctors interact with patients, they treat them, is without getting personal, they can't do that. And you guys are doing tremendous job with your patients in treating them and diagnosing them.
I think
And
I've lost.
thank you so much for coming for this show and taking out of time out of your busy schedule, ma'am. Thanks a lot for this.
Thank you.
Okay, I'll just repeat that thing. I believe I was lost
Because
somewhere
there was
in
a,
between.
yeah, there was some loss of connection in between in the last part when you were talking.
I just repeat that now.
Okay.
You said it right, ma'am. The patient and doctor's relations are always built on trust, and that the motive is to solve the problem. And that's how I believe all the doctors, including you, are involved so personally with the patients to help them to get the diagnosis right, to treat them, and to make their life easier. So we all as a society are grateful to all our doctors who are giving their time, effort, services, leaving their personal life aside, and making your patients priority. Thank you so much, ma'am, for taking out time out of your busy schedule and coming to our show. Thank you so much, and congratulations again on National Doctors Day to you.
Thank you, not just a doc, for bringing out a program like this, looking into what it takes on a doctor's part. Uh, uh, to be serving and to be available all the time and all that, and sacrificing their personal time and effort, because generally everybody feels, they are taken for granted. And when someone really appreciates you, you feel more motivated to give more. Thank you.
Thanks a lot, ma'am. Thank you.